the Minnesota Department of Health has been collecting the blood and DNA of the children of Minnesota for over 10 years. The department did that without statutory authority or without any parent consent or knowledge. And in March of 2007, a judge said that the 2006 genetic privacy law would require the Department of Health to get informed parent consent for both the genetic testing of the program as well as the collection of the blood and the retention of the blood, and for research, genetic research on the blood. The department decided that they would appeal that decision. They lost the appeal, and now they have come to the legislature asking for the newborn genetic program to be exempted from the state genetic privacy law. And one of the things that the people of Minnesota need to understand about that is that there are 73,000 children born every year, and the blood and DNA of those children now become state property of the Minnesota government. That means that the government holds onto the DNA and can provide that DNA for genetic research on the children of the state. In 18 years, every child turns a voting adult, and their DNA will still be the property of the state of Minnesota. So what we're saying is, if there is a genetic privacy law here in Minnesota, as there is, why are we going to exempt the DNA of every citizen born since July of 1997 from that genetic privacy law and continue that exemption in perpetuity? Because clearly that means that the genetic privacy of all the citizens of Minnesota starting since 1997, or at least since those who were born in 1997, that they don't have genetic privacy. The state of Minnesota does a variety of things with the blood and DNA that they collect. Thus far, as we see in this chart here, there are, as I said, since 1997, 780,000 children whose DNA is the property of the state of Minnesota. But if you look down here, there's 42,210 who have had their DNA given to genetic researchers. And genetic research has been done on those children without the consent or the knowledge of their parents. I know that the department also conducts their own internal research looking at the potential for having new genetic tests on every newborn child. What the state of Minnesota does is it collects 5 blood spots on every newborn child, typically before 24 hours or at 24 hours after birth. And they send 2 of the blood spots to Mayo, and then they keep 3 of them. And the Mayo Clinic does part of the testing, and the state of Minnesota does another part of the testing. We give the names of Susie and Henry and Dakota and Marianne and Aiden and Kaiko and Taisha to give an understanding that these are all the children from every nationality and every walk of life who have their blood spots owned as state property by the government. The genetic testing of babies has grown exponentially. In 2003, the department was, I believe, testing babies for only 5 conditions. They came to the legislature in 2003 and asked the legislature to give the Department of Health the ability to increase or expand the number of conditions for which children are tested without having to come back to the legislature and get permission. So today, the Department of Health tests children for 54 conditions, which is, I believe, the highest number of conditions that are tested for in the country, or at least it's very close to the highest number. Some researchers are now saying that we should test children for genes, genetic tendencies towards becoming obese, or having diabetes, or getting asthma, or perhaps even the tendency towards violence. In 2005, one of the leaders in newborn genetic testing came to the President's Council on Bioethics to essentially warn the council about just expanding the number of tests on children ad infinitum. He pointed out that the history of PKU testing has its own dark side, and he talked about the fact that states are going to begin actual DNA sequencing of children. And he warned the council that we really should not rush into the expansion of these tests. And he's actually was very concerned that this would be, I think he called it a calamity for the children and for the parents and for the families of this country. There's a big difference between opting out and opting in. Opting in is consent and opting out is not. If you have the right of consent, that means that nothing can be done to your child until you have signed on the dotted line saying that you understand what is being asked of you and that you give permission. Opting out, which is current Minnesota law, opting out means that they can go ahead, the department, the hospital can go ahead and do all of this without your consent unless you object. So we would like it for the state of Minnesota to give you the right of consent so that you are fully informed at a time which is very hectic and very hard, the birth of a child, labor, delivery, and all of the excitement and exhaustion postpartum. We would like you, as parents of the children, to be able to be fully informed rather than to hope that you saw what your options are and not get them. Parents need the right of consent to protect their children. Parents need to be able to know what's happening. They need to know that this is genetic testing. They need to be able to say yes or no. They need to know that the state of Minnesota is actually retaining their blood and considering their child's blood as state property. And they also need to understand that genetic research could be done on their child without their consent if they do not say no. So this, we would like people to think about these blood spots and understand that in those blood spots are DNA that can be used time and time again. They just take tiny itsy bitsy punch holes out of each blood spot. And so countless numbers of genetic research projects can be done on each of these children without the parents' consent or knowledge. Across the United States, 4.2 million children are born every day, and every state has a newborn genetic testing program, and almost every state has no parent consent, and almost every state is collecting the blood and DNA of every child. We think it's very important for parents and citizens around the country to reclaim the DNA property rights of the children and the citizens of this country. So it's very important for every citizen in every state to become engaged in this issue.